I want to discuss one of my patients who I met recently. He's a 65-year-old gentleman. He used to play tennis. He's a chronic smoker as well. So one of those days when he was playing, while serving, he just slipped and then he fell down on his shoulder. The pain was moderate in intensity, but it was lingering for about 3 to 4 days. So he met an orthopedician, and orthopedician took an X-ray. The X-ray did not reveal much, so the orthopedician told him to take 1 or 2 days rest and then give painkillers, and told him to start doing the activities. But eventually the pain got worse, and he was not able to sleep in the night, and he was not able to raise the shoulder above 90 degrees. It was, of course, with support he was able to, but after that he could not lift further. So the patient thought, okay, the pain will go away as time passes. Like that, 5 to 6 months passed. There is no much improvement in the movement. Of course, the acuteness of the pain reduced, but he was still unable to lift the shoulder past 90 degrees, and he was not able to sleep on the affected shoulder. So that was a complaint. So the patient met me couple of days back with the same complaint. Then we assessed him. He was having PROM full, but the entire range was painful. Even at 5 degrees itself, the pain started. So generally, when there's a supraspinous tendinitis or tendon tear, it won't start the pain at 5 degrees itself. So he was having the pain right from the beginning of the range and through the entire range. And while dropping the shoulder, I mean, literally that drop arm test was also positive, with a sharp tenderness over the greater tuberosity of the humerus. So we suspected supraspinatus tendon full thickness tear because of his smoking history and the history of fall. So we referred him for MRI because the pain nature was like it was not improving even after 5 to 6 months. The pain was constant in the night. He was unable to sleep on the same side. More importantly, the pain was starting right from the beginning of the range. So on these grounds, we wanted to rule out the tendon pathology, so we sent him for MRI. The MRI image shows this. You could see the MRI shows this. There's a mild bone edema with a small fluid accumulation over this area. So whenever there's a gap in the bone, the fluid will go and accumulate over there. So this is a T2 weighted image where it shows a slight bone marrow edema here and small fluid accumulation over the region around the greater tuberosity. So the radiologist got suspicion. It doesn't look normal. So he referred the patient for a CT scan. The CT scan looked like this. So this is one of the slices in the axial view of the CT scan, which confirmed a small fracture. It's a kind of undisplaced comminuted fracture in the greater tuberosity of the humerus. Both the MRI over here and the CT scan over here is showing that he is having undisplaced fracture of the greater tuberosity of the humerus, which was not picked up in the X-ray. So the patient was thinking it's a normal muscle injury or impact injury, so he was waiting and watching. But any pain which is not going away for more than 1 month, you need to definitely refer for imaging, especially so when the patient is old, because old people are having more vulnerability towards fracture than the young people, especially when the pain is throughout the range, night pain, old age with a history of trauma. It's better the patient must undergo a scanning or imaging so that you rule out an undisplaced fracture or something like that. This is not the case for all patients because it depends upon your clinical examination. You will decide whether to refer him for MRI or not. If the pain is like, let's say, mild in quality, if the ROM is full without much pain, when the drop arm test was negative, then you can try for conservative management. But if the conservative management does not yield result even after 3 months, then it's better to go for imaging, because of the fact that nowadays the imaging is not very costly and it's easily available everywhere. It's better to have the diagnosis clarified before you establish a treatment. So this patient I used here as an example of how sometimes it is useful to refer for early imaging in order to prevent sometimes irreversible damage, or in order to prevent the future disability as well. Okay, thank you.